Hi, I'm Jennifer Chino, and today I am joined by Ashlee Reibert from Unalome in Severna Park. I'm so excited to talk to you because this is a topic that seems to be coming up a lot for people, and it's perimenopause and menopause.
Yes.
I know we've had personal conversations about this before, which is how we met.
Mm-hmm.
And I know a lot of people are sort of just starting this journey or concept or just hearing about it. I think it's interesting because a lot of people from my parents' generation, it's not like that was very talked about. So it was sort of this little secret. So I would just love to sort of start with you and talk to you a little bit about that journey. And when you meet with someone, what are some of the questions that they have or some of the concerns, just, starting there?
Yeah. I think that a big part of our practice is this like perimenopausal age, perimenopause can start 10 to 15 years before you actually hit menopause. So we all think menopause 50 and then things go, and it's like starts, I'm 36 and I'm already starting with like regular periods and insomnia and anxiety. And, no one really talks about it. You just think you're a tired mom and tired wife.
So true.
Yeah.
So true. You chalk a lot of these symptoms, you sort of chalk up to other things.
Yep.
And it's so fascinating because once you have the knowledge and things start making sense, because like you said, they think 50 and they don't really think about it before then, but there's so many things that you can do to sort of offset those symptoms in a more natural and holistic way. And I think that's one of the reasons why I found you. Would you mind sort of going over when you meet with someone for the first time, what are typically the things that you sort of prescribe or have them do initially?
Yeah. So our initial intake, ideally in person, but we do a lot of telehealth too. We go over your past medical history, supplements, medication, and then we go through a lot of, possible symptomology that you might be having. And then from there, we come up with a workup plan for you, which, as you know, is a lot of blood work.
Yes.
Checking all of your sex hormones, really extensive thyroid testing. Sometimes we check some like chronic inflammatory markers, looking for Lyme disease and Epstein-Barr, which, we don't really check for very much either. We do 2 specialty tests for you, a saliva test to look at cortisol levels throughout the day, which that one's kind of hard to make enough saliva for.
It was hard. Not the first one in the morning was the hardest.
Oh yeah, for sure. Because you can't have your coffee. Yeah. Yeah. And then the urine test, which is pretty cool, looks at how you metabolize estrogen. And there are different pathways that you can metabolize that have been linked with DNA damage that can cause breast cancer and other female reproductive cancers. And then, all of that stuff comes back in like 2 to 3 weeks. We bring you back in, go over all of the results, and then give you a personalized treatment plan and kind of decide together what's going to work best for you.
Well, I say once we got my test results back, I was just absolutely floored with, and a lot of the things that you explained made complete sense. When you showed me the chart of the cortisol level and it was literally at the bottom of the chart, I'm like, oh, that makes so much. Things start making sense. And I know, the traditional medicine and when you bring up some of the concerns with your primary care doctor and you're all in normal levels, you kind of feel like, am I crazy? I'm in normal levels, but I don't feel normal. And then when you do the deep dive and do a more in depth, and then you explain, okay, this makes sense. And then this is probably why you're feeling this. And you just feel so validated because you're like, oh, that makes sense. And I'm not crazy because this clearly shows exactly what I've been feeling or the symptoms or whatever, or why I'm so, tired or I don't feel like I get enough sleep.
Yeah.
So once you go through the intake and you have the results and you go over that, describe sort of what traditional, I know it's specialized to each individual, but what is sort of a traditional or typical treatment plan that you go over?
Yeah. So perimenopausal time, usually like depending on symptoms, progesterone might be something that we want to start you on, which progesterone is are relaxation hormones.
Okay.
So you take that before bed. It helps, calm you down for sleep. It can help with insomnia, night sweats, and it can also help with anxiety throughout the day too. Sometimes you might need estrogen, maybe like the week before your period, if you have really bad kind of PMS symptoms, which can be really helpful. Testosterone is a big, big one that no female really thinks that you need testosterone, but it's a huge game changer for this perimenopause and menopausal age.
And explain the testosterone. If you increase your testosterone levels, what does that do?
Yeah. So testosterone levels, we want a testosterone level kind of at your prime age. So prime age, young 20s, your testosterone level is closer to 100. So, perimenopausal females, me, for instance, I did my blood work and my testosterone was 13, right?
Wow.
So, 13 versus 100. And when you do hormone replacement and get testosterone back, it helps so much with, my big thing was brain fog.
Yeah.
Like, I could not remember anything. My husband remembered things better than me, right? So brain fog, anxiety, insomnia, night sweats, joint pain is a huge one for females, and you don't connect it with testosterone.
Oh, it's interesting. I've heard a lot of people talk about frozen shoulders or joint pain. And so, and it's interesting because you take that and you say, oh, I'm in my 40s, I'm getting older or whatever, but it can be symptomatic of something other than just age.
Yep. Sure. Hormones. Yeah. And testosterone is so good for, the fatigue that we're all just tired all day and have an afternoon crash and, irritability. You feel like snappy and on edge, and get your testosterone levels up, and it helps. It's like life-changing for sure. So,
it's interesting to see the people that have sort of started, and then as they've gone through the process. Is there a typical length of time that people do the hormone replacement therapy?
That's probably one of the biggest questions I get asked, especially with younger females coming in. Like, I say, hey, you probably need testosterone and some progesterone. And they're like, well, if I start it now, do I have to be on it forever? So testosterone replacement brings your testosterone up to a level where you feel better. If you stop testosterone, you're going to come back down to that level that you were, or, just because of aging, that level might be even lower.
Okay.
So your symptoms will come back. Depending on what age you are, they might not be as dramatic for you.
Okay.
Most of our females do hormone replacements into maybe early 70s.
Okay.
I have a few patients in their 80s that say, do not ever take my hormones away from me.
I love it.
So
that's great.
They're really protective too. Like, it's not just a symptomatic treatment. They're so protective for so many things. So.
That's one of the things, as I've gone down this journey, I've understood as well. And I think it's interesting because a lot of the, traditional primary care doctors are still in that mindset that, hormone replacement isn't beneficial. And so when I was doing my research and everything, it was great to hear other stories from other women and really understand the research behind it. So I was, thrilled to find you and go down that journey with you.
For sure. Yeah.
Is there anything surprising that people wouldn't necessarily know or think to ask about the process of hormone replacement?
I think the testosterone one is the biggest surprise for everybody. I'm trying to think what
and it's
else.
Pretty easy. There's, the progesterone pills, and then there's multiple ways to do the testosterone.
Testosterone replacement can be a topical cream that you put on every day, an injection that you can do twice a week at home, or we also do pellet therapy too, which are like little Tic Tacs of testosterone that you get in the fatty part of your buttocks. And I think kind of during this whole process, we, especially during your first year when we're balancing your hormones, we like to check in kind of like every 3-ish months, kind of recheck those hormone levels, see how you're feeling, because it's not all based on labs. It's also based on how you're feeling and what tweaks we need to make.
And I love that because it's a constant conversation, because once you're starting it, you're sort of figuring it out, balancing it. And myself, I'm super conservative about how I start the process. So it's nice to be able to sort of build and then continue to have that conversation. You feel like as a patient, you feel like you're a part of the process, and it's not just here's a prescription, go
for sure.
do it.
Yeah. Yeah. Like you're in control.
Right.
We give you recommendations and kind of just give you those, tools, and you kind of figure out what's going to work best for you. And that's why we always say, like, give us this first year, because hormone balancing is, it's hard, and no one's the same. I do this for a living, and I can't get my hormones balanced right now. And I'm like trying. So it's just always a fluctuation, and we just have to work together and like have open communication, and, it's always in a flux for sure. So especially the first year when we're balancing. So.
Well, thank you so much for joining.
Yeah, for sure.
If you have any questions or would like to reach out to Ashlee, we will have all the contact information in the comments, and feel free to leave a comment or leave a like. Thank you so much for joining.
Hi, thank you.